Hi, I'm Dr. Ashoojit Kaur Anand. I'm the director of Aveksha, which is a home-based primary care services at PCMH Restore Health, Bangalore. My expertise is in palliative medicine and geriatric medicine. So we reach out to people at their home who are unable to avail services at a clinic or a hospital. Just to let you know that HIV positive does not mean that anybody who has HIV is at a risk of getting coronavirus. It is like general population where people who have HIV or do not have HIV are at the risk of getting coronavirus. But those with HIV, yes, especially those who are immunocompromised, that means among HIV, those who have a CD4 which is less than 200 or whose viral load are not undetectable, that means they are not getting controlled in spite of taking ART, or those who are not on ART. These are the people who are more prone or at a higher risk of getting infection with coronavirus or with any other virus. So the symptoms remain the same. The risk is higher among those who have these complications, and especially those who have undetectable viral load, those who are failing their medicines, and also have other respiratory infections like somebody with tuberculosis or what is called the PCP pneumonia. They are at higher risk of getting infected with coronavirus or influenza virus or a bird flu, any of these viruses.